we really tried to build this year's conference as sort of a let's take a moment and think about where we are in the science, right? So there has been an effort in the past year and a half, I believe, to develop headache research priorities. So it's a collaboration between the NIH, American Headache Society, and International Headache Society to think about what would we like to prioritize for headache research moving forward for the next 3 years, 5 years? And then we also had a talk from the director of NINDS, Dr. Walter Koroshetz, to think about where does headache science land essentially within neurology science at this moment. So I think we wanted to think about how can we move forward on the research side? And then we specifically targeted in the plenary sessions, we had one focused on under-researched diseases. So, headache diseases that not migraine, but the other things that we see day in and day out in clinic, but don't necessarily have a lot of research to guide us on. And then similarly, we did another plenary specifically on under-researched populations. So people who don't tend to be in our clinical trials or in our studies, patients who are groups who are less likely to come to our tertiary care centers, which is where essentially the academic people are practicing. And so to think about how can we make our studies, clinical trials in particular, more inclusive to make sure we're really representing all people with migraine and all people with headache diseases rather than just a specific subset.